Like the almost 80% of Americans who will encounter a back issue during their lifetime, Beverly Hayes experiences back agony. For some, the injury is set off by an exhausting action, such as planting or weightlifting. Others essentially twist down to get a pencil and their back gives out. "It seemed like a screwdriver was puncturing through my bones," the 46-year-old Chicago craftsman says about the torment that grew not long after she ran a half-long distance race. "It assumed control over my life. I was unable to twist down or rest. I was frozen. I could never feel ordinary again." Mary Ann Wilmarth, DPT, a representative for the American Active Recuperation Affiliation and head of non-intrusive treatment at Harvard College, says it is important that individuals address any back torment or injury immediately. Early intercession can help keep a persistent issue from creating and block the requirement for medicine and medical procedure, she says. Because of a mix of action, center fortifying activities, and exercise-based recuperation, Hayes says her side effects have improved drastically in the course of the most recent year. Here are 12 different ways to help ease back agony. 1. Cut off bed rest. Studies show that individuals with momentary low back agony who rest feel more torment and make some harder memories with everyday errands than the individuals who remain dynamic. Patients ought to maintain a strategic distance from over 3 days of bed rest, says Mike Flippin, MD, a muscular specialist who has some expertise in back and spine care at San Diego Clinical Center. "I urge my patients to get going as fast as could reasonably be expected." 2. Continue working out. Action is frequently the best medication for back agony. Basic activities like strolling can be extremely useful, Wilmarth says. It gets individuals out of a sitting stance and places the body in a nonpartisan, upstanding position. However, make sure to move with some restraint, Flippin says. Avoid arduous exercises like planting and maintain a strategic distance from whatever movement caused the agony in any case. 3. Keep up great stance. The torment may have begun after a long exercise at the rec center, yet the strain that caused it has most likely been working for quite a long time. Wilmarth says the vast majority have helpless stance while approaching their day-by-day exercises, putting pointless strain on their backs. Easily overlooked details add up, she says. You can press your back by half just by hanging over the sink inaccurately to brush your teeth. Keeping the perfect measure of bend in the back eases the heat off the nerves and will lessen back agony. 4. See an expert. Building up an individualized exercise plan is basic to overseeing persistent back agony, says D. Scott Davis, PT, MS, Ed, OCS, a muscular actual advisor and partner educator at West Virginia College. There is no wizardry anti-inflammatory medicine that tends to bring down back torment in everybody, Davis says. A few patients need more center reinforcing while others advantage principally from extending and improving adaptability. Locate an actual advisor, practice physiologist, or bone and joint specialist who represents considerable authority in back consideration. They will coordinate you with the correct exercise plan. 5. Reinforce your center. The vast majority with persistent back torment would profit by more grounded muscular strength. The middle is a mix of many muscle bunches cooperating, Plain B. Wyatt, Ed, educator of activity physiology at Missouri Western State College, tells WebMD in an email. On the off chance that the abs are frail, different zones must get a move on. At the point when we reinforce the abs, it regularly lessens the strain on the lower back. 6. Improve adaptability. An excessive amount of strain and snugness can cause back agony. Our objective in expanding adaptability is to put an equivalent burden all through the body from the feet as far as possible up to the head, Davis says. One great exercise is to sit on the edge of the bed with one leg expanded and the other one on the floor. Give your hamstrings a stretch by inclining forward while keeping your in an unbiased position. 7. Dump the support. It's enticing to child your back muscles, yet Davis says supports ought to be utilized sparingly. Supports are useful for difficult exercises, similar to hard work, yet just keep them on for 15 minutes all at once, he says. On the off chance that you wear a support throughout the day, the muscles, which ought to give dependability, debilitate and you will have less center quality. 8. Apply ice and warmth. Warming cushions and cold packs can comfort delicate trunks. Most specialists suggest utilizing ice for the initial 48 hours after a physical issue, especially in the event that there is growing, and, at that point, changing to warm. However, it is hard to state if ice or warmth is more useful, Flippin says. I suggest that patients use whichever they find consoling as long as their skin is insured. 9. Rest the correct way. The measure of rest you get is significant, as is the position you get it in. Dozing in a terrible position or on a sleeping pad without help can cause back agony, Wilmarth says. A few pointers. Back sleepers should put cushions under their knees. Side sleepers should put cushions between their knees to keep their spine in a nonpartisan position. Stomach resting makes the neck and head turn and can put excessive weight on the back. 10. Stop smoking. Illuminating doesn't simply harm your lungs, it can likewise hurt your back. An investigation as of late distributed in the American Diary of Medication found that current and previous smokers are bound to have back agony when contrasted and individuals who have never smoked. Nicotine makes the little veins contract and diminishes the conveyance of blood to the delicate tissue, Flippin says. I tell every one of my patients that stopping smoking could help mitigate their back agony. 11. Attempt talk treatment. Back agony is regularly observed with issues, for example, gloom and nervousness, says Alex Morose, MD, partner educator of restoration medication at NYU Langone Clinical Center. Your passionate state colors the view of agony, Morose says. Treatment can be a useful piece of restoration. 12. Use unwinding strategies. Exploration shows that practices, for example, contemplation, profound breathing, kendo, and yoga, which help put the psyche very still, can do wonders for the back. In the event that you can actuate an unwinding reaction, it will help diminish the apparent agony level, Morose says.